A little bit of background about me. I am a board certified internal medicine physician with the hospitalist group here at UNM. I've been here for 10 years. I did my residency here, my chief year here. I was extremely involved in leadership at all levels of my training. And I am very, very grateful to be here presenting on this topic that is very near and dear to my heart is mental health, and we'll go through psilocybin research and the practical applications today. Let me see. Okay, there we go. So we're going to talk about the trajectory of mental health as we have it right now, use of ancient medicines as novel therapeutics. I'm going to share some human stories with you because that gives us the dimensionality of how things are and how these therapeutics work. And then some thoughts about the practical implementations. Again, I don't have all the answers, but I know together we can find them. And this is a great fun. According to the CDC, adult synthetic opioid overdose deaths increased 18-fold from 2013 to 2020, which is highly concerning to me when I look at the source. I'm a source person. From the outside, you think, okay, sure, there's more opioids on the streets, but why are people using? This is not just everybody who's using these drugs. They're using it because they're hurting, that they're suffering, and they want to numb themselves. And that is what is very concerning to me. And these are the patients that I see every day on my service, on the hospital service. And it's very difficult to um, wrap my head around it as a physician who's here for that sacred relationship between physician and patient, wanting to do the best I can do to bring them back into a quality of life that is worth living. Majority of the time, I'm not able to do that. And so that is very heavy for me as a physician. And so we have been calling these deaths of despair. This article was written in 2021, looking at the reason why the life expectancy in the United States has been going down. And it is not old people dying, it is young people dying from suicide, alcoholic liver disease, and drug overdose. These are the two that I see very commonly, and suicide attempts, especially after the pandemic. It's just been uh, on high alert. This is a wonderful friend of mine, 31 years of age, on the left here, Alicia Hall, who died from a gunshot. It was suspected that the man who killed her was in a mental health crisis, and we know that in the past 6 months or so, there has been a 30% increase in gun violence coming from our trauma surgeons here at UNM. She was a beautiful, beautiful human and healer in the community, and um, had her life taken very tragically at age 31. And what does this mean for our children? Um, there is a concern that there has been an increase in child torture cases 12 times prior to the pandemic. This data comes from Dr. Strickler. And I'm sure many of you who work at UNM know her. But this study is under investigation through an IRB approved study. She actually, during the pandemic, as she saw this happening, she reached out to her friends across the United States, and they all confirmed the same thing that they were seeing. So this is very concerning for the future. And if, who's going to make a difference? Who's going to change things? It's you and I. It's someone who cares so much that is going to change this trajectory. Otherwise, nothing's going to change. What does this 12-fold increase in child torture cases mean? I can't, every time I talk about this, I get a little emotional because I can't believe people actually, these things happen in our society. But adverse childhood events we know are directly correlated to increased risk of PTSD, addiction, suicidality, and criminality later in life, if the trauma is not addressed at the time. So kids that have early childhood bonding with mom and dad and have a good family and they're living a happy life, they continue that cycle forward. They tend to have good, adulthood, and are good parents because they're passing on those patterns. Families that have very dysfunctional methods of child rearing will have children who become parents who will then have projection of the same patterns of beatings, of yelling, of having rage in the family, and we see the cycle continue on and on. How are these kids supposed to learn self-compassion? They don't, right? Unless there's quick recovery with the community and psychotherapy. How are they supposed to build compassion for others in society? And how are they supposed to have compassion for our planet? So, this compassion for others, when we don't learn to have compassion for ourselves, then we think everybody is a violator. We don't trust anyone. And so everybody is an other, instead of seeing us as a unified collective. So where we're living right now in the present moment on Earth is quite a nice time, as Dr. Work is on his hike in Colorado looking at beautiful trees with changing colors. Well, experts believe that we have about 60 more cycles of farming left on Earth before, more of a destructive pattern of climate change is going to occur with the topsoil being stripped away. There are people that are looking at solutions right now. Dr. Paul Saladino is one of them. I believe Sadhguru is another person who is raising awareness about this problem. But it's definitely something that we need to look at if we want to keep this gorgeous marble. And it is quite miraculous that we all live on this planet right this moment. So, how are we going to stop the cycle and hope, not hope, but create a path that we know is going to be beneficial for all of us? I love this quote by Eckhart Tolle. You're not in the universe, you are the universe, an intrinsic part of it. Ultimately, you're not a person, but a focal point where the universe is becoming conscious of itself. What an amazing miracle. And so the first step is for us to become conscious that this problem exists. And if you want something different, you're going to have to do something different. And we have choices no matter where we are in our lives, and even in despair of addiction, despair of depression, and thoughts of suicidality, we still have a choice. We still have a choice in how we respond to things, even things that are dealt to us in a not so great way. We still have a choice in how we're going to respond. So I've chosen to elevate myself and educate myself so I can educate others as well. So let's talk about psilocybin very briefly because our other speakers have done such a beautiful job talking about it. Psilocybin is, see psychedelic medicines as a tool for consciousness, and they absolutely have to be used with a lot of respect. Um, and Psilocybin is a natural tryptamine found in about 200 mushroom species. One awesome mycologist who is world renowned is Paul Stamets. If you want to look him up and learn from him, it's fascinating what he has found about mycology. This is going back into the history, the ancient history of psilocybin use. Um, Psilocybin has been used, well, now we have traces of it going back to 9000 BC. And here is a depiction of Persephone and Demeter. Persephone, the daughter who went to the underworld and comes out, I believe once or twice a year. I have to fact check on that, but comes up and they reunite. There's a ritual, and in ancient Greece, they would hold the illusion mystery rites where they would invite people from the community and allow them to be part of these rites, and they would drink this tea or this liquid called kaikion. Um, they have found some of this pottery that has ergotamine and some precursor to LSD in it. And it is known that people who went through the Eleusinian mystery rites came out better people and those who did not fear death any longer. And as you can see in the carvings, they're definitely holding mushrooms. And some of the famous people that came through the Eleusinian mystery rites were Socrates, Plato, Aristotle, and so forth, which I find very fascinating as well. These are some of the examples of different types of psilocybin mushrooms or mushrooms containing psilocybin. This is a brief history of use of psilocybin, and now we're looking at 9,000 BC. Here is what we were all talking about in 1970, Prohibition of Hallucinogens, where they made the Schedule 1 classification for these molecules. And, some of it for good reason. Um, there was a lot of mishaps that were happening, and these medicines are not without adverse events, as we've all talked about. So we have to be very careful in how we're using them. And as we've seen, research continuing on, this is the present moment. This is, some of the Johns Hopkins studies that looked at end of life and consciousness research and such, that we'll talk about shortly. Again, this is the molecular structures I'm not going to go through. Thank you for sharing your thoughts on these, Brandon. And again, the 5-HT2A receptor binding of psilocin. So psilocybin is the precursor, goes through the first pass metabolism, becomes psilocin, and binds to the 5-HT2A receptor. The rest of the actions are under investigation. As you can see here, this is from PubMed. This is the number of psilocybin studies over the years. So 1958 was the first one. And as you can see, there's this sharp increase in the number in the recent years. I'm just going to share a couple with you today. What I really like about psilocybin is that it does not have addictive potential. And we've talked about addiction over and over and over again in our New Mexico population. I think this is a huge plus that we see with psilocybin. This is Dr. Botts, our dear Dr. Botts study that Dr. Lehman also talked about at length. So I'm not going to go through it again because you know it. But this was very, very significant. Their remission rate was 80% in the participants who received psilocybin, plus heavy psychotherapy before and after. We cannot forget that. The other group, the Benadryl group, decreased by 25%. Oh, yeah. And this is so talking about community education, I've taken this role of being the educator. I've always been an educator and continue to be, but I was invited to an in-studio interview at Bloom NBC in Tampa. And I'm going to share a clip with you guys here with my gracious host, Gail Gallardo, and we talk about this topic
Is it
briefly.
becoming more mainstream? I mean, will we see it? Or because I've read books about this. I'm fascinated by it, and I have for years now. Will it become mainstream? Because I hear that even like if a treatment when you get to middle age, when you almost become like a step and repeat, where patterns get stuck in your own head, and it's hard for you to move on, and you've had a lifetime of this. Probably a lot of what you're talking about here, but without maybe an attachment to the being in the military or end of life, will we have access to this?
I think so. I think so. What we're seeing is that Oregon legalized it
Okay.
completely. So, people can. So I'm going to stop right there. I don't know if they legalized it completely. I was a little, what do you call it? I found out that Bloom NBC has about 36 million viewers. And I was a little nervous when I was there. But as you see, kind of the same question that keeps coming up from our audience today too hey, what about the people that absolutely need it right now? Like, can they wait another 2 years? Maybe they're suicidal by then. Maybe they're gone by then. So what are we gonna do with this population who has a whole life to live, and yet they don't have access? So um, we will move on. And, just looking at some of the studies, actually, the main study I was talking to Gail about that day was the phase 3 clinical trial with MDMA and also the psilocybin trial through Hopkins. This is from one of the participants in a double blind study on psilocybin. The sense that all is one, that I experience the essence of the universe, and the knowing that God asks nothing of us except to receive love. I'm not alone. I do not fear death. Pretty powerful. In 2016, there was another RCT done through Hopkins. They had 51 cancer patients with clinically significant anxiety or depressive symptoms. They gave a medium or a high dose psilocybin, and it was in a, again, structured therapeutic environment. And in that kind of structured environment, envelope is how Dr. Lehman talked about it. Their ratings of death acceptance increased, death transcendence increased, and as well as decreases in anxiety about death. This is the same group, and they followed these patients 6 months after the final session, and about 80% of the participants continued to show clinically significant decreases in mood and anxiety. 60% showed symptom remission into normal range. Um, 83% reported increases in well-being or life satisfaction. About 70% reported the experience as one of the top 5 meaningful experiences in their lives. And 70% reported the experience as one of the top 5 spiritually significant lifetime events. I think, for me, one of the most incredible things that we can do, and, in my line of work as a hospitalist, I put a lot of patients on hospice care inpatient, and you know, I watch them die on an inpatient unit, some with a lot of fear, and as many medications as we still give them. And, sometimes we're just numbing them out. But in order to, like, if we're able to get them through their anxiety of death, how incredible is that? So again, looking at the humanistic part of things, this was a study done, I believe, by the Carhart Harris group in Imperial College of London, looking at treatment-resistant depression in 6 months, 6-month follow-up. Um, and again, they saw pretty significant results six months post-treatment in a treatment-resistant cohort where they didn't need conventional antidepressants. This was 5 weeks after psilocybin, and then their 6-month follow-up was very significant also. Every study that I've looked at, the exclusion criteria is schizophrenia, bipolar, psychosis, or mania in the past, or family history of any of these conditions. So I'm going to share a story with you of a physician mom who is 35 years of age, has a child, and she's a single mom, is doing all kinds of things all at once, multitasking in life and at work. And she's also a physician leader, and, is a good one. There's a lot of us out there. Um, and she starts feeling burned out. She starts feeling severe depression and anxiety, and feelings of despair start creeping in. Though on the surface everything looks great. She has a great child, great family. Yeah, sure, she has a lot of responsibility on her shoulders, but she thinks she has a good handle on all of those things. So on the surface, everything looks good, but deep down, there's a lot of inner turmoil that's very difficult to deal with. So she finds out about physician coaching, becomes a physician coach, coaches herself through some of her own burnout, and gets into a lot of reading and a lot of interventions for herself. But there's still this undercurrent of stuckness and inability to move on to be able to live the way she wants to be living and to feel authentically herself. So she looks at the world map of where psilocybin is legal. She's also doing a lot of research on the psychedelic, world, reading books and articles and from reputable sources like Yale and Hopkins and all these different, Stanford, all these awesome institutions that have been looking at psilocybin for therapeutic use. Um, where is it legal? And this is the latest map. This is Brazil, and no, that is not Chile. I don't know where this is, but anyways, some South American countries they have it legalized, and some other countries, as you see, the yellow ones are ambiguous, and they do use traditionally in ceremony in tribal ceremony, indigenous populations still use it in ceremony. So she decides, okay, maybe it is time that I, participate. And this is me. This is my story of getting through not only my burnout, but also getting through some much deeper things, adverse maybe childhood events. And I will share some of those with you. Not being able to form vulnerable attachments. I lived in war for the first 8 years of my life in Iran. And as you can see, it was not a pleasant time to be living there. Not that it is right this moment either, but there was a chemical war going on. There were all kinds of stuff at the border of Iran and Iraq. Towards the end of the war in 88, when I was 8 years old, they started bombarding Tehran. And there were so many funerals that we went to as a child. People were just, and their sons would get drafted into the war. And I remember going to so many people's homes who lost their children to this war and lost family members as the city got bombarded. I remember one time my sister and I were sitting against a window at our condo in the middle of Tehran, in the very good part of Tehran, next to the foreign consulates, and a bomb dropped, and we didn't know what happened. We were reading a book, sitting on the floor, and we got thrown across the room. And we look at each other, ran to our mom to see what to do next. And usually it was that, hey, go hide under um, the dinner table with the huge thick um uh blanket over it, and close off all the windows so if the windows shatter, you don't get hurt. Or 3 a.m. we would wake up and my parents would be grabbing us. They wouldn't sleep all night. They would grab us at 3 a.m. and run us down to the shelters. So when I look back, I'm like, yeah, that can be traumatic. But at the moment, just being a kid, I didn't register it as much. And then, the concept of others first, which as physicians and as healthcare workers and as females in general, we know this, how we put everybody else in front of us. We prioritize everybody else's well-being before our own. And that's a deep, deep, deep cultural thing for me. Where we put everybody else, we feed them the best food we can. Even if it means that the family doesn't eat at the end of the day, your guests get the best food and they get fed. But then, that also means we welcome violators a lot of times, which is what we've done with the government, with the current government. Another thing that came up through my journey was this inability to speak my truth. And that's a really deep one that I had to dig and dig and dig for years to figure out, um, you know, without any medicine, but just myself. But it did come up during my session was this oppression. And having lived under a religious dictatorship where I couldn't speak about my spiritual practices, or just I'm talking about meditation at age 12, could not speak to anyone about it. And so since a very, I was a very young child, all of these things were just part of my patterns of, oh, you got to keep quiet, you cannot speak your truth. And so with this severe censorship, It just became a pattern that I didn't recognize until very recently. And we moved to America in 1995 when I was 14 years old. But those patterns stay with you for forever if you don't become conscious of it and decide to change it. So right now, actually, what's going on in Iran is, I don't know, you guys know, but there are riots against this oppressive religious dictatorship government, because they killed this young woman over the head. They hit her with a baton over the head, and she died of a brain hemorrhage 2 days later in the ICU. And there have been uprisings, millions of people rushing the streets, and women taking off their scarves and burning them in fires. And the motto is women, life, freedom, which it just gives me chills every time I look at this, because it's the tides have changed so much. Where you are in a religious dictatorship, it was all about male dominance, and now it's switched to women. And in fact, women are leading, and men are empowering them, and they're also flooding the streets, which is just awesome to see how they're pushing out the violators finally after 44 years. So through my journey, also what came was, if you could have such a beautiful perspective about yourself with clarity and with answers and with, perspectives that you didn't have before. um, how could I bring this into daily life? Because no one wants to be taking medications or medicines. I don't, every day or every year. I don't want to be, using psilocybin. It's not addictive for good reason. It can make you very nauseous. And these you need a lot of work, a lot of work. I had amazing spiritual practices um that carried me through. So when the difficult, challenging experiences came with my journey, I was able to deal with them and I was able to anchor myself. But I do not recommend this. I do not recommend this for just anyone. You have to have life practices that anchor you. You have to have breathing practices, meditation practices, exercise practice. I mean, nature, connection with nature is huge. So then I started thinking about, hey, how can I um mimic that life into here? Because one thing that a lot of us look for as humans is trying to escape. And I think, one of the things we've all talked about is, if we are using medicines, any type of medicine or substance, as an escape, it will be pathologic, and it is not something that is going to be um, uh, constructive for anyone. If you're trying to dissociate, then what are we doing here? Then you need therapy. That's what you really need. What are you trying to run away from? Um, but trying to bring it into life, bring the magic into life here and now and make it into a reality is what I'm all about. So about 3 days ago, actually, this is a candid shot that my husband took before the symposium. It was on Thursday, and or this past Thursday. He was like, okay, we got to get out. You got to, immerse yourself in nature, and we're going to have a day together. And I'm so thankful to him for this, because he reminds me about my own conscious life practices that I've developed. And there's about 12 or 13 of them that I actually teach to other female physicians without anything, without any medicine. This is just conscious life practices that we can utilize anywhere, any day, to optimize our physiology and neurobiology. So I'm going to tell you about the 5 different practices that you see in this photo right now. Number one is connection with my husband that day. I was able to break away from all the work that I was doing for this symposium, and just be with him. And talk about things and process things as they came. Um, the other one is meditation. Here I'm in deep meditation, just really immersing myself with nature, exchanging energy with nature. 3 is sunshine, 20 minutes of sunshine a day. That day I got some more than 20 minutes, but I'm very grateful for it. I feel good today. um What else? Connection with nature, that immersion into nature. And, there were a bunch of dragonflies that were mating that day. It's very interesting. I think it was just high season for that. So we got to watch them, and it was fascinating to watch, some creature behavior, and just feel connected, with the water, with the scenery. It was wonderful. And why do I do all those things every single day is for this crew right here. They ground me, and this is really what life is about. It's about being able to be healthy and happy within you so that you can be there for this crew right here. But if I'm not balanced, then I cannot be there in my best shape for my 14-year-old. She's 12 here, and for our now 2-year-old. Um, and I don't want to be there. I used to be there when I was super burnt out, and that's why I reached out to see where I can go. And I do not suggest that this is everybody's path, but it's something that helped me. And we absolutely need more research. We absolutely need more understanding of exactly what it is that we can do to decrease adverse events and challenging experiences. But to some degree, those challenging experiences sometimes are important, but we have to have support. If you don't have support, that is the number one determinant of, in my opinion, from my own experience, direct experience, and also the research that I see, the number one determinant of having a good outcome is having community support. Um, the practical application, I have to show you guys this because I repeated this about 3 times during my interview with Gail. Let me make sure I have the correct timing here. Let me see. 6:55. I think we're good.
Day in and day out. You
Sorry, technical difficulties.
seem to subscribe to the fact that it should be under doctor supervision alongside therapy and lifestyle changes, as you've mentioned again and again. So people are actually getting this under the proper safety of an umbrella of people that are in the know.
100%. 100%. Proper use is the right dosage. You have to have a guide who knows what they're doing, has to be supervised in a restorative environment with the right intention going into it, and follow up. Follow up is absolutely significant and essential in this. So you have to have psychotherapy, you have to have support from your community and family 6 months after, a year after. A lot of things are going to come up that you don't know how to deal with because these patterns have been broken all of a sudden. What are you going to do with all this information that you have now realized about yourself? So it's very important to understand, yes, these life practices are very important to get into and get rooted in prior to a session like psilocybin, and have the right environment and person to do it with, and follow up afterwards.
All right.
All right, as you guys saw, I repeated the same concept, I think, 5 different times because I think it's extremely important that the public know about this, and having been doing some research on my own in the community and talking to patients and reading articles and all of that, there are some churches across the United States that use psychedelics as their sacrament already. So that it is being used. And talking to my hairdresser, she was just telling me, "Oh, I got a package from Oregon, that's all psilocybin, and I got a package of mushrooms." And I was like, "Oh, okay, so how are you using them?" And she shared with me that she and her boyfriend used it in a restaurant, which just blew me away. And so this is why I take it so seriously to educate the public in having a restorative environment and doing it under the proper conditions that are healing, not making it so much worse. So to me, this is happening, but how are we navigating these waters? The next steps to me is massive education. We need massive education on all levels. We need to educate the educators. We need to educate and train the therapists and physicians and medical students and residents and educate, talk about it, because the more we don't talk about things, it doesn't mean it doesn't exist. It exists, and we just don't know about how to guide people through it, and educating the general population who apparently has a lot of access to all of this, even though the legal status is still, under question for our use as physicians, in prescription form. The general population has access to this. So I see it, man, as a huge part of my duty as an educator to talk about it. Um, Again, these are some of the legalities around it in different states. So, what I meant to say is that in Oregon, it is decriminalized throughout the state, and I believe it is legalized for therapeutic use under I someone was telling me, I maybe I read it somewhere, but maybe not a good source, but look it up for yourself as well. That in Oregon, it can be prescribed by therapists now. Um, so, state of California is right behind Washington, Colorado, and New Mexico. I believe in the next couple of years, there has been a lot of talks. Michigan, and some of the northeastern states are also looking at this. And this was a article in Scientific American, and I think it's important to look at the safety profile and look at the humanistic profile and come together and create forums to talk about this, and to educate and make sure that people are, if they're choosing to take this route without talking to their physician, even, we are, trained in how to deal with, let's say someone, goes to South America and has a psychedelic experience, they come back and they are in a manic state. What are we going to do about that? And so that's very important for us to also talk about. um Sometimes it's in medicine, it feels like, you are a firefighter who is watching a fire start up. You have the hose, you have the water, but it's illegal for you to use the water on the fire. And before we know it, it's a huge forest fire, and a natural disaster now with, lives at stake. But with proper training, with proper gear, with proper safety measures, and with a crew, it takes all of us to put the fire out. It takes a huge community to do this work. And so I thank each and every one of you for being here today on a Sunday, and asking questions and being engaged in this. Again, I don't have all the answers, but what, I've shared with you, I think one of the thoughts that I've had is maybe have a center for conscious medicine where we can all come together and have these discussions, people from all walks of life in the community, physicians, therapists, just layperson who needs help, needs something to get them through their treatment resistant depression, where they've used 4 different medications or, anxiolytics and all of that, and they still cannot get through. Maybe it's just simple, not simple, but trauma work that they need. Maybe it is psychedelics, maybe it's not, but having a center where everybody comes to be able to talk about these things, I think would be great, and it brings that community support in together as well. Again, I my motivation in everything I do is the next generations. I look at my own children and I wonder if we have the child abuse and child torture that's been going on at such high levels, what is it going to mean for the future of our country, for community and our planet, and our own children? Um, I would like a world where the term child torture does not exist, and that our adults are so balanced with their inner turmoil that they don't need substances and to get away from their reality. In fact, they want to be engaged and to raise children who themselves can continue this peaceful life. Um, and I believe that's all I have for you. Please connect if you have questions, if you have ideas. Again, I have some of the answers, but I think together we can find a lot more. And that's all I have. And I have like 5 slides of references